Okay, so for this question, we are looking at the neuronal pathway for the sense of olfaction or the sense of smell. So here's the question. During a nursing assessment, a patient asks about the neuronal pathway for olfaction or sense of smell. Which of the following best describes the neuronal pathway for olfaction? And then we are given here a list and we need to sort of put it in order. So, in looking at this, I really would like to sort of remember and review the anatomy going along with this. So I would take note from this question of what anatomical structures that I need to look into, and then I'm going to come back to this question and see about test taking strategies and answering it from there. So I need to be looking at the cribriform plate, the olfactory bulb, axons from the olfactory neurons, interneurons, and the olfactory tracts and olfactory cortex. So I'm going to see if I can pull up a picture of that. So over here, I have a picture of a little bit of that anatomy that we can go through. So this way we can orient ourselves and give ourselves a picture of what we need to be looking at to be able to answer the question. So first of all, I will draw into here. So obviously this is our nose. This is our cribriform plate, part of the ethmoid bone in our nares here. And our smells are going to be coming, this is our nostril here, so our smells are going to be coming out here from the environment, and they're going to be coming up through the nose and come into contact with these olfactory fibers. And the olfactory fibers, that is just another word for the neuron axons. So you have our axons down here. We have chemical substances that are going to be coming in from the environment and coming into contact with these olfactory fibers or nerves. And then those axons are going to go up into the cribriform plate, which is part of the ethmoid bone. It's going to be going through the cribriform plate because this cribriform plate actually has holes in it, also called foramina, where those axons travel through carrying this information that has been converted from a chemical message here into synaptic information, and then it's going to travel up through into our olfactory bulb. And it's actually the axons themselves that create this olfactory bulb. And then from there, it will go into the more soft tissue areas that you can't really see in this photo, but they're behind. Here's our ethmoid bone and our cribriform plate location right here. We're looking down from the top of the skull as if you cut someone's head in half. And then we are taking that slice and looking down from it on the top. Here's where our spinal cord would come through. This would be our frontal lobe, our parietal lobes, temporal lobe. So in our frontal lobe here is where we're going to have the rest of our neuron bundles and everything from this olfactory bulb, all the tracts coming back into our olfactory cortex, which is just going to sit right here in the frontal lobe. So then, now that we've oriented ourselves a little bit, we can go back to the question and see if we can use some test-taking strategies to figure out exactly how we want to answer this. So remember we said, so one of our things we have here is axons from the olfactory neurons. And remember we said that the chemical synapse happens right on those axons. It goes through the nose and happens right on those axons. So even from the first glance I have at all the first things in my answer choices, I can see there's only one of them that says axons from olfactory neurons. So from the get-go even, I can really rule out the rest of these. But we will go through the rest of this just to be thorough. So first our chemical smell hits the axons from the olfactory neurons, gets converted into a synaptic information, and then those neuron axons travel through those foramina of the cribriform plate. They travel up into and create the olfactory bulb, and then that olfactory bulb synapses with other interneurons that then travel through olfactory tracts and into the olfactory cortex up in the frontal cortex of the brain. So after seeing that, we can see that our answer to the question is D.